Hi, welcome to Violence in Healthcare by Jennifer Joyce. This is a presentation for SP22 NU 471-7Q for Mount Mercy University. My name is Jennifer Joyce. I'm a registered nurse and pursuing a bachelor's degree with Mount Mercy. This is a quotation that I found on the Ontario Nurses Association page, and I believe this perfectly describes what we go through. It's not just the physical abuse, the hitting, the scratching, the biting, the spitting. It's much more than that. It's not just the verbal abuse, the name calling, the put downs, the racism. It's much more than that. It's not just the emotional abuse, the anxiety, depression, and sleeplessness before shifts. It's just so much more than that. It's the helplessness. So, what is workplace violence? Workplace violence is categorized by OSHA, or the Occupational Safety and Health Administration, as a recognized hazard in the healthcare industry, unfortunately. It's any act or threat of physical violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the work site. So anytime you have somebody loud coming into the emergency room, anytime you have visitors that don't want to leave, that are affecting care of your patients, anytime you have a patient that is combative or physical with you, that is actually considered workplace violence. As nurses and healthcare providers, we walk a very thin line between providing that quality care for the patient and a safe environment for our patients and families to be in, as well as keeping ourselves safe while executing these job duties. And it can become a very fine line. We don't want to put ourselves into positions that could potentially harm us, but we also want to make sure that we are providing the best possible care for our patients. Every year, the Bureau of Labor Statistics releases data on every position that is held within the United States. All of these positions have a reporting code, and these statistics are staggering in that it shows not only is workplace violence for healthcare workers on the rise, but it is grossly underreported. From 2016 to 2020, there were 207 deaths due to workplace violence. That is a practitioner, a nurse, a doctor, patient care tech, medical assistant, someone along those lines that was providing care for a patient that was killed in execution of those job duties. There was an overall incidence rate of 10.3 out of every 10,000 full-time workers. This does not count for part-time workers, nor does it account for any kind of small injuries that did not require a day off of work. So if you got injured and went back to work, that was not included in this particular 10.3 out of 10,000 number. And in 2020, an article had been published by OSHA stating that 21% of the nurses and nursing students had reported being physically assaulted on the job. That came out of the Cleveland Clinic. However, it's unfortunate that all of these numbers are not accurately reflecting what goes on in the hospital and healthcare systems every day. Unreporting or non-reporting of acts grossly pales in comparison to what is actually going on. At least 70% of emergency nurses have been reported being hit or kicked while on the job, myself included. And this is, again, a stark comparison to the numbers that were given by the Department of Labor. 100% of all healthcare workers at some point have reported a verbal assault by either the patient or a family member. Emergency room and psychiatric healthcare workers have an increased risk of assault. because of the lack of reporting on by either the nurse or the healthcare systems, it's really hard to get accurate numbers on what is actually occurring in the hospitals. And this is actually a quote from one of the articles that I read. Police often downplay such assaults, and this alone deters providers from calling as they feel it's a waste of time, since the patient will not be arrested or ticketed. And if they have found that a crime has actually been committed, I know in Iowa they actually have to retain an officer on site to keep that person in custody. So it puts a strain as well on the police force, which is all the more reason to get this under control. How are our hospitals and healthcare systems responding? We have hazard prevention and control. So your healthcare administrators and your leadership should be looking at your facilities, the layouts, the access points within your facilities, and they should be understanding the risk factors with the patients and the environment that we're working in. You should never be in a room in between and let the patient get in between you and the door. You should never be alone in a room with a patient that is known for physical assault of nurses, some stuff along those lines. Management's commitment and worker participation. Every report should be recorded regardless of whether it resulted in an injury or death, or if it's just a complaint of verbal harassment. Plans and programs are driven by data. So when we are able to capture enough data to get a good picture of what is going on in our healthcare systems, it's only then that we'll be able to fix it. Record keeping and program evaluation. Again, along with the recording the incident, it creates creating an environment of zero tolerance is paramount for our leaders. This is hard to do because a lot of times hospitals don't want to press charges against patients due to Press Ganey scores, and it's a very sticky wicket. Safety and health training. For every emergency room nurse, we go through, for Unity Point, we go through something called CPI, or Crisis Prevention Intervention, and we learn how to de-escalate situations prior to. Unfortunately, there are times that de-escalating a situation is not possible, and that would be where self-defense training comes in. Self-defense training is somewhat included in CPI, but it is definitely used for defense. So it's not exactly getting a black belt in Taekwondo or Taibo, but it is helpful. And lastly, worksite analysis and hazard identification. This is where, again, leadership needs to look at identifying factors such as the neighborhood crime rates, making sure that there's adequate staffing for both the nursing staff as well as security. It was quite frightening to read that some hospitals only have security till 3 a.m., and that's about an hour after the bars close. So that's about when everything kind of kicks off in the middle of the night. We also need to kind of pay attention to long wait times, and if we don't have enough beds to accommodate the needs for the patients, or we don't have enough staff to accommodate those needs, that needs to be addressed with leadership. All of this requires our nurses to have a voice and to have a loud voice when we approach our leadership teams. Mandated reporting is something that we don't see for nurses and violence in the workplace, but it should be a program. We are mandated reporters for child and dependent adult abuse. It needs to be something for nurses as well. And like I said previously, for any plan or program to see results, it does require data. Again, this is a quote from a different article by the same author, Dr. Ball. We all know that workplace violence is rarely underreported, severely underreported. I've seen a lot of nurses don't want to report when they get hit, bit, or punched. They make excuses while the person was just upset, in pain, or a little confused because the room was dark. Extenuating circumstances for reporting abuse should not be considered. A patient should be on their best possible behavior regardless. And I know we make exceptions for some patients that have delirium, sundowners, but those are far extenuating circumstances. This should not be the norm for us. Recording data is very interesting when you look at this data set, or the lack thereof, because every agency has a different way of capturing all of this data. Data should really be housed or collected by one agency that's external to the hospital and the healthcare systems, such as the ANA or the ACEP, the American College of Emergency Physicians, so it can monitor the incidence and prevalence of abuse and assault within the healthcare profession. By having an agency that is not affiliated or that is external to the hospital and the healthcare system, it provides an unbiased look at the data and can give us some really good reflections on how we are capturing data. Within that, data should be, as much data as possible should be collected. What area of nursing are they in? How long have they been a nurse? Diagnosis of the patient. Were they triaged appropriately? Was this a family member? Was it a verbal assault or was it a physical assault? What happened during the assault? All of that should be recorded so it can be classified as accordingly. And last, extenuating circumstances, like I said, they shouldn't be included in the report. It should have no bearing on the patient behavior. If you're assaulted, you're assaulted. Police officers, attorneys, judges, they all deal with stressful occurrences every day, and they all deal with people they deal with people that are under a great amount of stress and strain, and they would not be assaulted because people know that you would have charges filed against you if this was something that you had done to a police officer. It needs to be treated the same way for nurses and first responders. And lastly, with the recording of the incident, it should also be reported to the local authorities. Police report filed. A part of the problem that we have with having district attorneys and prosecutors go after people that have feloniously assaulted nurses is that they don't quite think it's a problem because they don't see very many cases of it, because we don't report it, because there's a lack of prosecutorial standing, whether they sympathize with the person that has done the assault or whether they have just chosen not to prosecute it at all. It's because they're not seeing very many of these cases come across their desks, so it becomes more of a one-off than the norm, and we need to make it the norm. So the more cases they see, the more that they'll actually want to do something with them. And lastly, we get to enforcing the legislation for this. There are 31 states in the United States that healthcare assault is actually felonious, bearing a felony charge. Hospital and healthcare system leadership must support and enforce a zero-tolerance policy. If this is a climate that I unfortunately think that nurses and healthcare systems have reached an impasse, and we are being unceremoniously thrown under the bus for things, and unfortunately it's time to put bygones aside, or fortunately we can put bygones aside and be a better system together. Violence against healthcare workers should not be tolerated. Is just part of the job. When I started in emergency nursing, the first time I was ever assaulted, I was taken aback. I was incredibly hurt and wounded, and told my charge nurse that I was, going to make a report to the police. And he said, "Well, you can make a report to the police, but the hospital is not going to back you up, and you will ultimately have your case turned down by the district attorney." And I've been assaulted several times since then. So getting buy-in from the local law enforcement as well as the state legislature has to be something that we use our voices for. And using our voice for that, we have to be able to prosecute to the extent, or based on the law, not based on the extenuating circumstances around the case. Everybody has something going on in their life. It doesn't give you a pass for bad behavior. And we should be addressing the stakeholders in states where it's not considered a felony to make it so. The rise of violence against healthcare workers is not going away. It's picking up speed, and this legislation would be able to give us. It would give us something to be able to stand on, and make those changes that we need so desperately in our healthcare systems and our work environments. I thank you for your time and all of your listening, and I hope you enjoyed the presentation and that you have gleaned something out of it, and I look forward to seeing you another time. Have a great day.